Elements of the listening process. If you just want to follow on pages 304 to 307, the following topics will be covered. So there's hearing, attending, understanding, responding, and remembering. Hearing. The physiological dimension of listening occurs when sound waves hit the ear at a certain frequency and loudness. Hearing is also influenced by background noises. If there are other noises that are at the same level as the important sound, it becomes difficult to understand the important sound. Hearing is also influenced by continuous exposure to the same tone or loudness. An example of this is if a patient is trying to listen to two doctors at the same time, they may become lost and mixed up in what the two doctors say. The patient may become confused to what one or both of the doctors said.
The next element of listening is attending. Hearing is a physiological process, attending is a psychological process, and is part of the selection process. We would go crazy if we attended to every sound we hear, so often we filter out some messages and focus on others. What we attend to is determined by our needs, wants, desires, and interests. Not surprisingly, research shows we attend most carefully to messages when there's a payoff. Attending does not only help the listener, but the message sender as well. For example, listening to a doctor's diagnosis. If someone goes into a doctor's office and the doctor is giving a diagnosis, it's important to attend because a doctor's diagnosis often has a payoff when we are struggling with a certain sickness or ailment. The next element of listening is responding. Responding to a message consists of giving observable feedback to the speaker. Listeners don't always respond visibly to a speaker, but research says that they should. Good listeners show that they are attentive by nonverbal behaviors such as eye contact and reacting with appropriate facial expressions. Verbal behavior also demonstrates attention. It's easy to imagine how other responses would indicate less effective listening. A slump or yawning send a message that one is not tuned in to the speaker. Listening isn't just a passive activity. As listeners, we are active participants in a communication transaction. We simultaneously send and receive messages. For example, in class when a teacher is speaking, students respond through watching and engaging with eye contact and also verbally by answering the teacher's questions.
Hello, world!
Hi, Dan!
The next element of listening is understanding. Understanding occurs when we make sense of a message. It is possible to hear and/or attend to a message without understanding it at all. It is also possible to misunderstand a message. Examples: a child may say they have a pain and point towards their stomach. The doctor can understand that the child has pain in or around their stomach, and from there attend to the child's needs, even though the doctor may not understand exactly where the child is pointing. Also, a doctor may ask a new nurse for a certain drug. The nurse may misunderstand what the doctor said and bring the wrong drug. The final element of listening is remembering. This is the ability to recall information. Research suggests that people only remember about 50% of what they just heard. They forget half, even if they work hard to listen. Within 8 hours, that 50% turns to 35, and after approximately 2 months, that 35% drops down to 25%. Given the amount of information we take in every day, the remaining message is a small fraction of what we actually heard. Although the tendency to forget information is common, there are ways to improve your attention and recall. Example: when a weight loss patient goes to see a specialist, the specialist will give them information regarding weight loss. This information must be properly remembered in order to implement effectively. This is the end of our broadcast. How much of the presentation do you remember?
Bye, Dan!